Hello. This is a presentation on the automation in localizing and detecting diseased kidneys in MRI scans using deep learning. My name is Rushal Johal, and with the assistance of the University of Pennsylvania Health System, or UPenn and Children's Hospital of Philadelphia. Opening my successfully filed USPTO patent application was a tangible symbol of my biggest dreams. My journey began with manually tracing and scanning MRI silhouettes of inflamed kidneys to gather vital biological data, such as water volume and iron content. This required drawing 10 outlines per MRI scan layer, and each kidney having 40 layers. It's a cumbersome process for physicians conducting genetic disease testing. I pondered, there must be a more efficient way. Autosomal recessive polycystic kidney disease, or ARPKD, is a rare genetic disorder affecting 1 in 20,000 children. It's caused by fluid-filled cysts in renal tubules of the kidneys, leading to decreased kidney function and eventual failure by mid-40s. Deep learning, or DL, can revolutionize early ARPKD diagnosis and transform the healthcare industry by collecting and analyzing data from MRI scans for various diseases, potentially saving thousands of lives. I'm currently studying computational data science at George Mason University in the College of Science and have versatile programming experience in R, Java, and Python. Thus, I applied these hands-on skills in scientific research, specifically interning in MRI radiology at the University of Pennsylvania's Perelman School of Medicine and Children's Hospital of Philadelphia during my summer of 2022. While there, I evaluated how an image filtering DL algorithm is controlled to detect and localize early telltale signs of ARPKD in adolescent patients by examining MRI scans, known as DICOMs. In this presentation, we'll cover the current problems with diagnosing ARPKD and its data collection process, how this DL algorithm actually functions and its limitations, and the algorithm's implications and extensions throughout the medical industry. To first understand why ARPKD is challenging to detect early in its problematic data collection process, we'll cover its relevance with DL. Machine learning, or ML, is a subset of AI, focusing on training algorithms to improve their performance and knowledge on specific tasks by learning from past data. Think of it like a baby learning how to walk by first crawling. Dr. Anwar Padani, spokesman for the 2016 International Conference on Radiation Medicine, describes DL branching from ML by utilizing neural networks, like a brain neuron, with many interconnected layers to automatically extract patterns from data, enabling a high-level abstraction in complex tasks like image recognition. ARPKD is difficult to diagnose early due to having no cure, few symptoms nor pain, and delayed development of cysts by the time the risk patient typically reaches 12 to 14 years old, where tissue trauma has already occurred. Furthermore, the symptoms of excess water retention simulate a steep exponential growth between the patient's age and kidney size, almost indistinguishable from a healthy linear-sized kidney growth as the patient matures. Current data collection begins by extruding DICOMs from another picture archiving and communication system, PACS, often used in the medical industry, to be mapped into standard coordinate systems, almost like the ones we use in math. We collect data by freehand drawing regions of interest, or ROIs, as silhouettes of specific tumors within the kidney. According to nephrologist Dr. Charlotte Gimpel's 2019 PubMed publication, this tedious methodology is time-consuming, susceptible to human error, unable to localize cysts and DICOMs with blurry qualities, and inconsistent among varying DICOM series. Now, understanding DL's relevancy in streamlining ARPKD's data will focus on the algorithm's operation and limitations. Digital image filtering and artificial neural networks of multiple input and outputs automate localizing ARPKD in DICOMs. The steerable algorithm applies high radio frequency and edge detection of image pixels to detect abnormally sized cysts compared to the rest of the kidney structure. The same approach is applied for Snapchat filters, detecting our facial features based on lighting. Once multiple DICOMs of the same patient study and have been uploaded, the algorithm leverages prior pixel data to improve performance for the same repeated set of tasks. However, the algorithm may initially experience difficulty differentiating ARPKD's appearance from a healthy kidney in a DICOM, or not generalized to different genetic variations of ARPKD. This can lead to misdiagnosis by false positives for ARPKD. However, Dr. Kodos Ido's 2021 publication in the National Center of Biotechnology Information revealings find that this algorithm can replace the manual method by decreasing medical uncertainty and random error by 18% with an accurate detection success rate of 93%. After comprehending this algorithm's method, let's focus on its implications and extensions in other healthcare fields. This algorithm can be implemented in various medical record softwares, such as the popularly used Epic systems, and includes multimodal fusion, combining information from multiple imaging modalities, such as CT and ultrasound, to improve localization accuracy. Lastly, the method may detect early patient liver and bile duct cancer risks. The algorithm minimizes the time required for diagnosis and treatment planning. It also provides quantitative measurements of cyst size, distribution, and progression over time, helping track disease progression and evaluating treatment efficacy in real time, not possible prior. Thus, we can tailor personalized treatment plans based on each patient's severity or unique ARPKD symptoms. However, legal issues can be a barrier, such as using huge amounts of confidential patient data or risky financial investment for many underfunded hospital systems nationwide. As you can now see, this DL algorithm's invaluable potential derives from how it humanly operates, its extensions in several healthcare sectors, and problems with diagnosing and collecting data from ARPKD. Overall, this image filtering DL method can change the healthcare industry by diagnosing unaware patients at risk, not just in ARPKD, but any disease study via MRI DICOMs, even if a cure does not yet exist. We have covered DL's importance in solving ARPKD diagnosis and addressing its concerns, the new algorithm's methodology and its constraints, and its impact on healthcare. Evaluate how you may incorporate DL into your everyday life. Allow an algorithm to teach itself and to do the complicated, repetitive set of tasks for you better after each try. After all, ML is just a baby learning how to walk, but sooner than you realize, it will learn to drive a car. Here are my references. Thank you so much for your undivided attention.